This little routine is going to be great for those of you that have kyphosis or tension across the shoulders here and the head's going forwards. We're going to have a little stretch to open out the chest area, an engagement exercise to work the muscles on the back. We're then going to do a nice prolordotic exercise to support the natural normal curve in our neck and oppose some of that kyphosis that can creep into the lower part of the neck. And we're going to finish up on the floor with a lovely stretch again to support the natural curve through here. These should all be done in a nice and gentle way. You shouldn't be forcing any of them, and none of it should cause any pain. If it is, then you need to take a step back and maybe be a bit more gentle with the stretch or activity and make sure that you're doing the technique in a correct way. So with that out of the way, the first stretch we're going to be doing is a nice chest stretch to open out the chest. And you can do this in a doorway. I would suggest you do one arm at a time. The reason being, you can just focus on that one side and avoid the risk of pushing your head forwards, as so many do when they do these stretches. Remember, we want to at all times keep our head up in good posture. So come into the doorway like so. Have your elbow a touch higher than your shoulder. Down here is not necessarily going to get the best stretch. So ever so slightly higher than the shoulder at the level of the elbow. And then we just lunge forwards into this position and allow our shoulder to move backwards round. And we should feel a nice stretch coming down across the front of the chest. You can always turn slightly away from the door and that will intensify the stretch here. You can hold this for 30 seconds and then repeat on the other side and do each side twice if you can. It'll work really nicely. Hold the stretch here and then when you've finished, just simply step back nice and gently and pop your arm down. Remember, after you've been holding a stretch for a long period of time, just jumping out of the stretch can sometimes give you a little bit of discomfort. So dismount with all of these exercises or stretches in a careful, controlled way as well. Once we've opened the chest out, we want to move on to an engagement for the middle back muscles. And a great one here is the W raise. And we have to make sure we have our head in the right position. So our chin should be sort of on the table, our eyes just above the horizon. We should not be pushing our head forwards like so, which is the classic mistake so many make. And then we're having our arms to make a W position. And it's helpful when we're doing this movement, if we exaggerate the roundedness at the front, it just makes those of you that are beginning with this exercise a little bit easier to feel what we're supposed to be feeling. So we start with a very closed position as if we're holding a ball, and then we open out into the W position, and we imagine our breastbone, the bottom of our breastbone, is moving up to about where the anchor is on this particular frame. And as we come round, we open up and we squeeze our shoulder blades together, down and back through here. Ladies, you're going to feel it around about the bra strap here. Guys, same position between the shoulder blades. And then we're going to come up, we're going to hold it there, and then we're going to come back down. We're going to open out again, and then back down, and open out again, and then back down, and open out again. Always thinking about your shoulder or your chest, coming up and forwards towards the front, rather than going backwards like so. That's going to jar your back and create unnecessary discomfort. And again, as we come up, our head comes up into that really good, nice posture position. Now, you can make this a little bit harder if you use a band, and exactly the same is going to be done. We're going to be in this rounded position, holding the ball, and then we're going to come out into the W position, and then we're going to come back. And then we're going to come out into the W position, and then we're going to come back. And again, one more time from the front, it's going to be out into this W position with the arms, and then back round. Out, and then back round. And this is going to be working all of those muscles between the shoulder blades. Some of the larger ones, your trapezius muscles, it's going to maybe get the lats involved a little bit as well, these through here, and really help you hold a very good posture. You want to ideally be doing 10 reps of this, and we could do a couple of sets here, maybe 3 sets. You could do a few more reps, but I would suggest that if you're looking to improve your posture over time, then using something like resistance bands to help you progress the strength is going to be better than just doing endless reps. So now we've sorted out from the shoulders down, supporting that good posture, and you're hopefully a bit more aware of having your head over your shoulders. You're going to next use a rolled towel. And as a pro tip, you can use a very strong band for this exercise instead, but a nice towel rolled like so is going to be great. And what we're doing is we're placing this around the mid to lower portion of our neck. Now, in days gone by or years gone by, when we think of things like the dowager's hump, it was often a posture where we had a hyperkyphosis of the thoracic spine and the head was going forwards. And therefore, a straight chin tuck like so would actually do a really good job. The problem is nowadays, a lot of people with this same sort of posture have a slightly different variation, and that is an actual straightening of the lower cervical spine, and in some cases a kyphosis or forward bending of this section of the spine. The dysfunction, if you will, has moved a bit higher up, and therefore using this as a fulcrum at the base of the neck and then doing the chin tuck like so just helps create a little bit more of an opposition to the cervical spine, to the lower cervical spine, preventing it flattening out further. So as you're going backwards, you're actually putting a little bit of a pull forwards on the band or on the towel, depending on which one you're doing. But it must be placed in the lower portion of your neck. So you're going to do something like 10 to 15 reps where we're simply going backwards like so, and then there. Backwards like so, and then there. And you'll notice my eyes are looking slightly up or horizontal to slightly up as we're doing this. And you're engaging those muscles that retract the head. Very, very important. Note how much different this position here is to the traditional chin tuck, where people tuck in like so. This is not going to help if you've got a lower cervical kyphosis, as is so much more common these days. And just to be a little bit more clear with the spine about these two variations, the old style, the rounded over like so, is that. So when we just pull back, everything goes back to a better position. But nowadays, we're seeing more things that look like that. And therefore, if we just pull back, we don't actually help the curve. So the purpose of the towel, this is the lower part of your neck. This is about here, where the purple stops and the blue starts. By actually having the towel to fix that point there, as your head pulls back, we restore a nice, normal, natural cervical lordosis. And this is so much better. And I will say, using the band, a strong band, can make this that little bit more specific. But make sure you're doing it again without any pain. To finish up this final part, you're going to take that same towel and roll it like so, nice and tight, and we're going to get onto the floor. You're going to be lying over the towel in the same position here, and this is once again supporting that natural curve in the cervical spine and just allowing you to rest there for 3 to 5 minutes. We'll pop down to the floor and show you how to do this. So this one really does have to be done on the floor, unfortunately, but you want to have the towel nice and large, maybe a little bit smaller than a foam roller. And what we're going to do is lie on our back like so. You're going to pop the towel, lift our head up, place it down so it's touching our shoulders, about where the base of the neck is, or the bottom purple segment there on the spine, and then we're going to relax over this. You might need to play around with the size of the towel just to make sure you can feel it pressing into the neck and supporting that backward arch. A few tips here. Your chin and eyes and face should be pointing away from your body. If you have the towel in this position here, this is a big mistake. You're pointing towards your feet or your legs instead. It must be low enough down so you're supporting the natural curve in the lower part of the cervical spine. And then you can relax here for 3 to 5 minutes, or even 20 seconds to start with if you're a bit uncomfortable about this. It is normal for it to be a little bit strange for the first time, as we spend so much time looking down at our phones these days. And then when you finish, this is very, very important. You place your hands either side of your head so as not to twist your spine or your neck. And then we're going to roll slowly to the side, bring the towel to just support our head, stay here for a few moments, and then we can pop ourselves up. So just to recap, we've got the chest stretched to open out the chest muscles. We've got the middle back engagement through the W raise to start to tighten up those muscles that support our good upright posture. We've then got that modified chin tuck, using the towel to support normal, natural cervical alignment. And then we're finishing up on the floor with that towel stretch. We can substitute out the W raise by using some bands to make it a little bit better. And we should be aiming for around about 30 seconds on the chest stretches. We should be aiming for about 10 to 15 reps on the W raise, using resistance to progress ourselves to get stronger. We should be aiming for 10 to 15 reps on the cervical lordosis exercise or modified chin tuck. And that you don't need to progress, that's just a practice. And then finally, that towel stretch on the floor, you're looking at around about 20 seconds if you're feeling a little bit nervous about it, but 5 minutes or so as a general rule. Don't do longer than that. It should feel really nice, really relaxing once you're comfortable, but you've got to make sure you roll off to the side and just stay there for a moment before you pop yourself up. Give this routine a go a couple times a day, and see how you find it with regards to any neck pain or shoulder discomfort that you get. If you need any more help, you can always reach out to us.